let's just look at the numbers hitting a record in the United States in new daily cases yesterday. Anywhere from between 37,000 or 45,000, depending on which data source you use. Evercore ISI puts yesterday's at 38,000. So that continued uptick in the new cases. And of course, the positive rate of tests also rising for more than a week and a half. Yesterday, it was 6.7%. So that indicates, of course, it's not just increased testing contributing to this. In multiple states reporting new daily highs in case numbers yesterday, from California reporting more than 7,000, Texas and Florida as well. Arizona is now seeing testing capacity under strain, and hospitalizations, as you can see here, are continuing to rise. Houston in particular calling out its ICU capacity really coming under strain. Last night, Houston's health authority was on the 7 o'clock show with Scott Wapner, who asked him if they should put their reopening on pause or even reverse back to shutdowns. Here's what he told Scott.
There are consequences, not only economic, but there's also healthcare consequences to that too. So I try to tell people we are no longer at a point where we can eliminate the risk. We now need to think about managing the risk.
So not looking at going back to those shutdowns. And this is what we're seeing around the country, guys. If you look here, it's mainly states putting their reopenings on hold rather than actually reversing course. Either states or various counties taking these actions. There is one county that encapsulates Boise, Idaho, that is going in reverse. They told bars and nightclubs that they had to shut down again after a concerning surge in cases. They've been open for just a month. But really, guys, right now what we're seeing is a pause. Even as public health experts say, some places might need to consider going back to those more stringent mitigation steps. Back over to you.
Hey, Meg, yesterday Goldman put out a note that said they think the line at which states would be under pressure to reverse the reopening process would be about 20%, or hospital capacity below 20%. Is that sort of the general Maginot line that you're hearing?
There are a few gauges that you can use. If you look at the guidelines put out by the federal government and the CDC's guidance on those guidelines, if trends just start going in the wrong direction, they've been saying you can move between the gating stages if your trends are going in the right direction for 2 weeks. And the CDC says municipalities should act swiftly if they see those trends reverse. And that's not what we're seeing. So perhaps that 20% hospital capacity is a good threshold to use. And we are seeing many places with less than that available right now.